Are your eyes red and you just want to get rid of that redness fast? I'm going to review 5 different treatments to get rid of redness quick. Join me now. I'm Dr. Rupa Wong, board-certified ophthalmologist, managing partner and co-owner of Honolulu Eye Clinic for 15 years, and top doctor for the past 13 here in Hawaii. Are you looking for ways to get rid of your eye redness fast? This is a super common complaint, and in this video, we'll be reviewing 5 different treatment strategies and what to look out for so that you know when it's something to be worried about and when you should be going to the eye doctor. First, let's review what causes red eyes. The overlying thin tissue of the eye is called the conjunctivitis. It covers the white part of the eye. It's filled with little arteries and veins, and when they get inflamed, it can cause redness. Now, there are many different reasons to have redness in this part of the eye, and we're going to review them and how to specifically treat each one. The good news is that most of the things that cause red eyes are not vision threatening. So you truly don't have to be concerned that you're going to go blind or you're doing something wrong by not going in immediately to your eye doctor. So let's talk about these treatment strategies. First, the drops that everyone immediately reaches for, Visine. Now, why don't eye doctors like Visine? Visine has been around since the 1950s. The active ingredient is tetrahydrozoline, 0.05%. It works by narrowing the small arteries and veins of the eye. This is why it helps relieve redness. This particular active ingredient, the tetrahydrozoline, is what we call an alpha agonist, and it is non-selective, meaning it targets both the alpha-1 and alpha-2 receptors. Why is this important? Using Visine regularly can actually worsen red eyes in the long term. Initially, it helps a lot because it constricts the blood vessels of the arteries and veins, makes them smaller so you see them less in the white of your eyes. But with repeated use, your eye can get accustomed to this. Your blood flow actually gets altered, and when you stop taking the eye drop, you get what's called rebound hyperemia. That means that your eyes will be more red than they were before, something that most people absolutely do not want. Instead, if you're looking for a quick fix for eye redness, the one I recommend more is Lumify. I've done an entire video on Lumify where I use it on my own eyes. You can take a look here. Lumify is preferable because it doesn't target both the arteries and veins of the eye. It selectively targets the venules, the very tiny veins of the eye. It's a selective alpha-2 receptor agonist. And by targeting the veins, it's not going to reduce the blood flow to the eye. That means it alleviates any potential decrease of blood and oxygen to the front surface of the eye, unlike Visine. And since it's not targeting the alpha-1 receptors like Visine, there's very minimal chance of rebound hyperemia. Now, the indications on the box say that you can use it 4 times a day. I know a lot of people that use it daily. Still, this is not something that I personally would recommend that you use absolutely every day. I tend to use it when I am giving talks, when I'm doing photo shoots, family pictures, doing YouTube videos, or traveling. I definitely use it when traveling. It is a great drop. However, both of these drops are doing just one thing. They are masking the symptoms. They are constricting the blood vessels, whether arteries or veins, so that you don't see the redness. But a lot of the reasons that most people get redness then are not being addressed. And so let's get into them. One of the biggest reasons that most people have redness is dry eyes. Dry eyes causes redness, sometimes foreign body sensation, even feeling like there's sand in the eye, a gritty sensation, can even feel extremely painful and blur the vision of the eye as well. So to treat the underlying problem of dry eyes, artificial tears are the mainstay of treatment. You can use them with preservatives or preservative-free. Preservative-free is always going to be better, but you're going to find that you need to use them more often. In addition, there are prescription eye drops which can help your tear glands actually make more tears. This is really good for people, especially if you are a woman, perimenopausal, postmenopausal. There does tend to be decreased tear production in that particular patient population. Restasis is the name of one, Xiidra is the name of another. And when we institute these eye drops, we tend to add a steroid drop on top of them. That is because these eye drops tend to sting a lot and they take 6 weeks to 3 months to take effect. So this is not a quick fix. However, it is going to be addressing the underlying problem of dryness and over the long term will get rid of the redness. So though it's not fast, it is something to start doing now and eventually you're going to get there. Dry eye treatments also include hot compresses, whole host of things that can be done in the office, things like IPL or LipiFlow. And there have even been vitamins that help with dryness, omega-3s, omega-6s, or curcumin, hydro eye. These are all things that many dry eye practitioners really feel can help. Third, conjunctivitis. If we treat conjunctivitis, that's going to help your red eyes. What is conjunctivitis? Conjunctivitis simply means inflammation of the conjunctiva. Conjunctiva is that clear covering over the white part of the eye. The three main causes of conjunctivitis include viral, bacterial, and allergic. This is going to cause the tissues of the eye to become inflamed, often causes some tearing. Depending on which type of conjunctivitis, you may also have discharge and, of course, redness. If you have viral conjunctivitis, typically the treatment measures are going to be supported, meaning artificial tears, a lot of hand hygiene. You're going to be washing your hands constantly, wash your bed sheets, your towels, your linens, all in hot water. This is extremely, extremely contagious, so you want to be mindful of what you're touching and typically stay home from work or school for at least the first 5 to 7 days when you're having symptoms. Most adults do tend to have viral conjunctivitis, but most children tend to have bacterial conjunctivitis, and this is a common reason for redness in children. If there is redness, though this disease is self-limited, meaning that it's going to improve on its own, many doctors will give an antibiotic drop just to help with the symptoms and shorten the duration. This is the one time where an antibiotic eye drop is helpful. An antibiotic does not help with viral or allergic conjunctivitis, and so this is why it's extremely important to see your eye doctor to determine the type of conjunctivitis that you have and treat it appropriately. Bacterial conjunctivitis, though contagious, is not nearly as contagious as viral conjunctivitis, and you might have it just in one eye, it may be in both eyes. The discharge tends to be a lot more than in viral conjunctivitis. Allergic conjunctivitis also causes red eyes and typically also causes itching, profound itching. That's why topical antihistamine eye drops such as Patanol or Patidate or now Zaditor can be of great benefit for patients who suffer from allergies. In addition, systemic antihistamines are great as well, though I like for the treatment to be targeted towards the eyes so that you're not just treating the whole body if you only have eye symptoms. Here in Hawaii, we get a ton of allergic problems, and allergic conjunctivitis is top on my list. Fourth, infections, ulcers, and contact lens related problems. When you have an infection that's not just conjunctivitis, an infection of the cornea, which is the clear dome-shaped covering of the eye, your eye is going to get inflamed and red as a response to it. This typically happens more often in contact lens wearers, usually in contact lens people who tend to sleep in their contacts, who may be stretching out their lens, wearing it overnight, as well as wearing it for longer during the day than they should, or even doing some risky things like wearing them when they are swimming in hot tubs or showering in them. But it can also happen to individuals who have none of those risk factors, who don't wear contact lenses at all. A corneal ulcer or corneal infiltrate is something that's very serious, and you absolutely have to see your ophthalmologist for treatment. The type of antibiotic drops might even be stronger than what you can get via prescription from your local pharmacy. So again, really, really important. The redness that accompanies these type of infections tends to be 360 degrees all around the eye. Sometimes you'll see a white spot on the eye itself or in the periphery overlying the colored part of the eye. And that's the corneal infiltrate or the corneal ulcer. Contact lens related issues can also cause a lot of redness separate from infection. If you overwear your contact lenses, if the contact lenses don't fit properly, they're not letting enough oxygen to the front surface of the eye, or if they're misshaping your cornea, all of these can cause redness as well. And there's no quick fix for this. This is something that your eye doctor is going to need to examine, check the fit and the movement of your contact lens, check for something called giant papillary conjunctivitis, which is a type of conjunctivitis that we see as more of a reaction to the lens itself and the chemicals and preservatives in the lens solutions. Sometimes it's an easy fix of just changing out your contact lens solution, changing out your contact lens so that going from a monthly to a daily can improve the redness immediately. Again, something you want to discuss with your eye doctor, and if you think that you are having these issues with your contact lens, see them immediately. And last, there are a host of medical problems that can cause redness as well, especially something called uveitis. Uveitis is inflammation within the eye, so not just restricted to the front surface or the conjunctiva. We tend to see this in a lot of rheumatologic conditions, things like juvenile rheumatoid arthritis. We can see it in lupus and Wegener's. All sorts of different medical conditions can cause uveitis. Oftentimes, we also see it postoperatively. It's normal to have a little bit of uveitis after you've had cataract surgery or any type of surgery to the front surface of the eye. Again, this can only be diagnosed by your eye doctor, but the hallmark is redness in one or both eyes, depending on which eye is affected, and extreme light sensitivity. Some people will also see floaters in addition to that. If you're having that triad of symptoms, redness, floaters, and light sensitivity, absolutely see your eye doctor immediately. All right, guys, I hope that video was helpful. 5 different ways to treat eye redness and knowing when you need to go in and see your eye doctor. If you have any questions you would like for videos to be addressed on those topics, please drop them in the comments below. And until next time, I'm Dr. Rupa. Bye for now.